My name is Miad Najafi. I'm a registered osteopath and a Brazilian Jiu-Jitsu black belt with over 20 years experience in martial arts and physical training. This video is a simple sequence of exercises for maintaining joint mobility and improving the quality of your movements. Okay, standing with your feet hip width apart. Now you're going to collapse as you breathe out. Shh. And as you breathe in, you open up the shoulders. Turn your palms up. Breathe out, collapse. Breathe in, opening out the shoulders. So again, 8 to 10 reps of this is what you're looking for. Now we're going to go into side shifting. Arms out parallel. You're going to shift, opening out that waist, opening out your rib cage a little bit. Try to keep your arms parallel with the ground. Really opening up those waists. Now we're going to combine those two movements. So you're going to collapse, go open out to the side, extend up, and then bring it forward into the out breath. Now we're going to drive our hips forward, trying to keep your heels on the ground. And as you're sitting back, you're going to try and sit back on an imaginary stool. And you're driving your hips forward. And you drive your hips forward, make sure you look straight ahead. Again, it's got to be within the pain-free range, and between 8 to 10 reps is what you're looking for. Keep the weight going broad through your feet and weight through your heels. Now we're going to put weight through one leg, and the weight-bearing leg, we bend that knee and try and open up the lateral aspect, the side aspect of your hip. So you should feel this in the muscles on the outside of your hip. Bending that knee. Again, if it's too painful, you stop. Okay, it's got to be within the pain-free range. Okay, should feel a stretch, but it shouldn't be any sharp pain with this. You might need a chair or a table to support yourself here. You're going to take the hip joint through its range of movement. Try not to bend the back too much. Try and keep the movement pure going through the hip. Flexion and extension. Okay, you can do that as you comes forward. You can bring the knee up if you're finding that's too difficult, but try and straighten out the leg when you take it backwards. And now we're going to do adduction, which is bring the leg across you, and abduction. Again, try and minimize any movement that's happening in your spine. Try and really bring the movement and focus it in the hip joint, ball and socket joint at the hip. Now we're going to combine a little bit of internal and external rotation with some movement of the knee. So you're going to try and open out, bring that heel up towards you. Okay, one way and then the other. You need to open out the knee one way and the other. And we're going to come up now into a 90-degree bend into the knee, and we're going to turn the toes out, keep the toes turned upwards, and we're going to rotate at the knee joint. That's your internal external rotation. Now we're going to flex and extend the knee. Try and get it going through its full range, again within the pain-free range. Now we're moving into the ankle, dorsiflexion and plantar flexion. Turn your toes up and then down, up and then down. Okay, now we're going to turn it inwards. You turn the sole of your foot inwards, point the toe down, and then you point the toe up and turn the sole of the foot outwards. And now we're going to combine all those movements. So again, putting that ankle joint through its full circumduction, combining those two movements together, pointing with the toe one way and then the other. Again, you're looking at 8 to 10 reps, so give yourself a good 15 minutes to be able to work through this full sequence. Okay, now take your arms out in front of you, heels to the floor, knees wide, a little bit wider than hip width, and you're coming down into a squat, a full squat. If you're struggling to do this, you might need to put a rolled up towel under your heels, okay, to raise your heels up, because you might notice that your heels want to come up as you go down into a full squat. If you can go through the full squat and it's pain-free for you, you can sit deep down into the squat and try and find a resting position here. If you can, get your elbows on the inside of the thigh, palms together, and just really let your sitting bone, your pelvis just drop, and let the hip open out. This is a very, very natural position for you, and it should be something that we should be working towards. Squatting is an excellent way of getting good mobility in your pelvis, your legs, and your spine.